Cervical spine manipulation for radiculopathy. It almost seems counter to logic that a patient with a known disc herniation would undergo a mechanical procedure that involved rotation if prejudiced with an assumption that this could only further damage the disc and make things worse. How often, in fact, are chiropractors accused of causing disc herniation with a manipulative maneuver? Consider, though, that this may be a chicken or egg phenomenon where herniation already exists but is undetected by clinical exam, and when manipulation exacerbates the symptoms, medical referral for imaging reveals the culprit that was already present prior to manipulation. It's also possible that further damage does not occur and that manipulation has an ameliorating effect on symptoms. Recent studies are pointing in that direction. The publication we are reviewing today examines the safety and effectiveness of manipulation for patients with confirmed radiculopathy in Outcomes from Magnetic Resonance Imaging Confirmed Symptomatic Cervical Disc Herniation Patients Treated with High-Velocity, Low-Amplitude Spinal Manipulative Therapy, a prospective cohort study with a 3-month follow-up. This was published in the Journal of Manipulative and Physiological Therapeutics in 2013. Now, although 63% of asymptomatic athletic male patients over the age of 40 have protruding discs in their cervical spine, herniation is far more rare, accounting for only around 5% of symptomatic patients. In fact, the cause of radiculopathy in the cervical spine is largely due to foraminal encroachment and not herniation. In 3 systematic reviews for neck pain and radiculopathy published over the last decade or so, the conclusion was that there was insufficient evidence for the use of manipulation, but not evidence against. The concerns are, of course, the risk of exacerbation of a herniation or, at the very least, symptoms. Let's now review the participant requirements in this study and the study protocol prior to reviewing the results. This study was conducted in Switzerland at a single field practitioner's office. 50 patients were included in this study, and there is no randomization or control group. The inclusion criteria were stringent in confirming radicular involvement, including neck pain and moderate to severe arm pain in a dermatomal pattern, and sensory, motor, or reflex changes corresponding to the involved nerve root. There had to be at least one of the following positive orthopedic tests for radiculopathy: the upper limb tension test, the cervical distraction test, Sperling's test, and cervical rotation less than 60 degrees. And importantly, cervical disc herniation confirmation on MRI at the corresponding spinal segment. Exclusion criteria were the standards, including tumor, infection, inflammatory spondyloarthropathies, osteoporosis, prior surgery, stroke, pregnancy, and cervical spondylitic myelopathy. The researchers used the following measurement tools: a numerical pain scale, neck disability index, and patient global impression of change. These were measured at baseline, at 2 weeks, 1 month, and 3 months. A commonly utilized measure of improvement, the Patient Global Impression of Change, or PGIC scale, is a 7-point verbal scale rated as follows: 1, much better; 2, better; 3, slightly better; 4, no change; 5, slightly worse; 6, worse; and 7, much worse. In this study, only patients with scores of 1 or 2 were considered improved. So how experienced were the treating chiropractors? The treating DCs in this study completed the mandatory 2-year full-time postgraduate residency program in Switzerland. The 3 DCs had between 6 to 30 years of clinical experience. The participants were treated 3 to 5 times per week for the first 2 to 4 weeks, and then 1 to 3 times per week thereafter until the patient was asymptomatic. The results were impressive, with participants reporting being better or much better in the following percentages: at 2 weeks, 55%, 1 month, 69%, and at 3 months, 86%. Also, the reductions in the numerical rating scale for neck and arm pain scores, as well as the neck disability index scores at 3 months, were approximately between 66 and 75%. It's important to note that only 1 patient was worse after treatment. Let's compare this with the results of an injection study for radiculopathy, where patients received two cervical nerve root blocks consisting of a corticosteroid and anesthetic. Researchers reported only 24% of these patients had a clinically relevant reduction in their symptoms. One Swiss study concluded that radiculopathy was not a negative predictor of improvement with chiropractic management. In other words, if chiropractic management worsened a patient with radiculopathy, this would be considered a negative predictor of improvement. But in this study, if a patient had radiculopathy, their outcome was the same as patients without radiculopathy. So, based on the results of this study and previous studies, patients with radiculopathy are not only safely managed using a high-velocity, low-amplitude manipulation, but also experience improvement, whether acute or chronic. Criticism scientifically will be that this was not a randomized study. There was no control group, and the study population was relatively small, reducing the power of the conclusions. And these are legitimate scientific concerns. Yet, this is an excellent beginning to larger-scale studies that are needed to either strengthen or weaken the conclusions of this study. Studies like this that are practice-based are more likely to reflect the average practitioner's observation that their results are better than RCT findings. This might be explained by the fact that patients in these prospective studies seek chiropractic care and may be biased toward a positive outcome. Now, scientifically, this is flawed, and the results of these studies can't be extrapolated to those who don't choose chiropractic care. But for those who do, the outcomes are largely positive. It's likely the patients don't care about the science, but care about their results. So this study might be a better reflection of clinical practice, at least this practice, and regardless of its scientific flaws, might be more realistically reflecting the outcomes in practice versus the control of a scientifically more sound study. It can't be overstated how important this study is and its potential to affect future research and guidelines.